Manson. I'm the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. And we are delighted that you could join us today. If you will keep your Zoom on mute, and if you have questions, to type them into the chat bar, we would appreciate that. And I'm going to turn the program over to Donna so that she can do a proper welcome from the Kentucky Nurses Association in 30 seconds or less. Donna.
Okay, I don't think that's going to be a problem. Can you guys hear me okay?
Yep.
Okay, well, welcome. I believe this is our second in the what we're kind of anecdotally calling the Dr. Ruth series, but a series of half-hour presentations from nurse experts throughout KNA about what's going on with COVID and particularly vaccinations. So welcome to this edition of this. The last one we had was wonderful, and really appreciate Ruth's time, Delanor's time in putting this together. And I believe Misty is our presentation person today, right? Other than
Yes.
Right. So Misty Ellis is a nurse practitioner who specializes in pediatrics, and that's kind of going to be our main topic today, but we will also entertain questions about other things that might be going on. So I'm going to hand it back to Delanor and we'll get started. Thanks everybody for coming.
All right. As Donna said, this is the Dr. Ruth Show. And the Dr. Ruth Show is beginning now. And Ruth, I just need for you to leave me 2 minutes to talk about the rest of the series. Perfect. And all of the other great things that are going on within KNA. And I present Dr. Ruth at this time.
Very good. Thank you so much. I appreciate the opportunity, because we all know that without nurses being actively involved in communication in our communities, then the effect of this pandemic can be much more profound, and our ability to care for our community can be diminished without our leadership. So we have put together information, and I'm keeping it in a PowerPoint format so that it can be shared with you, and then you can kind of see sequentially the topics, some of the questions and answers, and then use those as you are doing communication with others and sharing information with others. So this is the information that we provided at our last session. We had a few updates that we added, looking at some of the topics that we have had about, full approval and dealing with children and healthcare workers. And that let us know we had so much interest in pediatrics. So today we have with us a wonderful presenter, be here to give us information and help take questions. Misty Ellis, I'll let Misty tell you a little bit more about herself, but she's been so instrumental in KNA, has been part of the board, the leadership, has been wonderful, both on the academic side and the practice side. And I think, that is another value. How do we continue to study and apply our knowledge in the community? Misty has a lot of background expertise in cardiovascular issues, which I think will be important today. So Misty, can you give us just a little bit of overview about you and your experience? And then I want to launch into some questions for you today.
Great. Thanks, Ruth, and Delanor, and to KNA, especially for hosting these sessions. These have been fantastic, and I think wonderful for the nurses across the Commonwealth. So I am Misty Ellis. My background is pediatric acute care. So I have my clinical experience for the last 20 years has been in pediatric intensive care and pediatric cardiac intensive care. So I take care of the sickest of the sick in the state of Kentucky. And very fortunate to have worked in Louisville at Norton Children's, and now in Lexington at Kentucky Children's with some very phenomenal intensivists, nurse practitioners, nurses. Both institutions are wonderful children's hospitals that provide really high level care for patients. And in particular, what we are seeing are COVID cases. We had a nice dry spell last year when this pandemic started. Fortunately, children were spared, but that is not the case now. And it is gaining rapidly in children across the state. And so I'm actually working today. I worked yesterday. In the 2 days, we've had multiple admissions in our ICU. two of them pretty sick, one requiring intubation and mechanical ventilation support. Been speaking with my former colleagues in Louisville, and they have been absolutely slammed, and their ICU is full. And just to kind of put it in perspective, this was hot off the press yesterday from Children's Hospital Association and the APP. I mean, over 5 million cases of COVID have been reported in children. And in particular, in the last 2 weeks, we've seen over 200,000 cases. And so this is just rampant in children right now. What this is leading to is multiple hospital admissions, both in Lexington and in Louisville. And pediatric intensive care level admissions, not just to general floor wards. And to put that in perspective, I think this is really important for folks to take away from, is that the infrastructure, the healthcare infrastructure for pediatrics is not as large as our adult healthcare system. So when you think about across the state, the ICUs in Lexington, Louisville, and throughout the state, Northern Kentucky, wherever you are, there are many ICU level beds, right? But in Kentucky, we have 2 hospitals, and in combined, we have 58 ICU beds. That's it. And so when you think about how quickly this is approaching children, we don't have the infrastructure to support them at an ICU level if many more children get sick. So we have to be mindful of that. We have to be able to have the support for them. And unfortunately, just this past weekend, Kentucky has seen their first pediatric death. Now, this is not the first pediatric death in the country. We are seeing that more and more. But for Kentucky, there was a pediatric death associated with COVID. I think it's important to highlight that the CDC and the APP recommends COVID-19 immunization for everyone greater than 12 years of age. Very few contraindications to this, and they can be given in conjunction with other immunization. I think when we really focus on risk versus benefit, we have to be mindful that safe doesn't always mean that it's harmless. All vaccines have side effects, which include pain, redness, swelling, but that doesn't mean they're unsafe. And it's the same thing we deal with lots of children with lots of medicines we use. We use an enormous amount of medications for children to treat them that are not FDA approved. We don't hold chemotherapy agents for patients with certain types of cancers because it's not FDA approved. So we have to just sort of be mindful of that risk versus benefit, and thinking and knowing that the science says that this is number one way that we can prevent the spread of this is vaccination. And really being mindful that vaccines are safe. And the dangers they prevent are far outweigh the dangers that can be subsequent secondary to COVID. I think that it's important that what we're seeing in children, and all the children that we have seen that have been critically ill, both in Louisville and in Lexington, have been unvaccinated children, okay? So adolescents, we are seeing are extremely ill, requiring intubation, mechanical ventilation, even ECMO, which is extracorporeal membrane oxygenation. It's like bypass. And we have placed children on that. And what's important is that these children may develop overall end organ dysfunction or end organ failure. So respiratory failure, cardiac failure, renal failure, so multi-system failure. And you probably heard this MISC, multi-system inflammatory syndrome in children. And it's real. Actually admitted one this early this morning. And these children have a cardiac component, which affects their cardiac function. So they have reduced cardiac function. So their heart muscle doesn't work as well. And we have to monitor them and making sure that they don't progress and need other support. Sometimes they do need support. In fact, we had one child here at UK in August that was very sick and required ECMO. And even the thing that we do know, unfortunately, is that COVID can, result in death. Not to mention the type of care that it needs for these children. Pediatric intensive care medicine, that's the highest level of support that you can get. The other thing we have to be mindful of is that, the mental health side of this. You admit children to the ICU, that is not where they want to be. That's not where anybody wants to be. But it is hugely impactful on them. It's very scary to them when you can't breathe and we're doing all these things and we're putting these special masks on you just to help support you as a child. I also think that, as a provider, it's important to me that I take in consideration the parental side of this and maybe the fears associated or the unknowns of if they do vaccinate their kids. And so I think just in sort of general recommendations that we have to be mindful of when we're talking to people is to be good listeners. Like, listen first. We don't need to be people that insert our opinions, even though we may know all the information. I feel like I'm very educated and I know it's the right thing, but I'm not going to get anywhere with a parent that doesn't vaccinate. And so I think that we want to be very thoughtful about listening to them, becoming partners with families, helping build this relationship so that we can work together and really, stress the benefit of it, but work through some of the things that they might be scared of in order to get more children vaccinated. And so those are some of the things that I share with you today. Now I would like to really welcome your all's questions or thoughts, commentary. I'm open to discussing anything with you today.
I think that's excellent. Thank you, Misty. These are wonderful. And so as we get questions in the chat, I think, Delana, are you going to keep an eye on those and post some of those, and so we can see what the people want to hear? So,
yes, I am monitoring chat for you.
All right.
And so far, we've gotten a lot of accolades for Misty's information. Great job. Also, people want a copy of the slides. I want to make sure everybody knows that we will send the slides at the end of the presentation. And so
I'm sorry to cut you off, Delnor, but I did want to make sure I put a plug in that I also believe in hand washing. I do think that we need to continue to do that. And the other thing that sometimes people talk about masking, one of my own family members really hated the mask for her children and just felt like it was just horrible. Well, her children really didn't care about the mask. She cared more than they did. And she talked about how gross the masks were. And I was like, well, it's like you wash your underwear, right? Like, you're going to wash the mask. And I always emphasize, if there's gross stuff in your mask, can you imagine what's on your kid's sleeve or in their shirts or on their desk, right? And so I always think about how important that is for kids and, from that standpoint, from a masking.
So Misty, we have a question in the chat box. It says, are you seeing long-term effects for children?
Yes. So some of the children require tracheostomies, and so it takes some time in order to work to have those trachs removed. The other thing is just really muscle debilitation. So lots of rehab afterwards.
Next question that we have is that in the one death of the child, was the child unvaccinated?
Unfortunately, yes. Another story, there's another child that is critically ill, intubated, and their family did not believe in vaccinations, any vaccinations, so not just COVID, but they felt like their young boy, who was strappingly healthy and fit, would never get this. Unfortunately, he's critically ill, intubated in the ICU. They all want to get vaccinated. They want all the vaccines now. They are going to get vaccinated, and they're going to get him vaccinated.
The next question that we have, Misty, is what are the most common symptoms that you're seeing in children now?
So very similar to what you hear reported. So they start off with sort of fatigue, fever, headache, cough, and then it just sort of progresses, and it progresses from a respiratory standpoint. So children have respiratory distress from the virus. They also seeing a lot of headache and fatigue. And then some kids are complaining of some chest pain. Obviously, we do see that with the multi-inflammatory system process, the MISC. Some children will complain of chest pain, but mostly respiratory. Lots of difficulty breathing.
Next question is, are GI symptoms common in children with COVID?
We've seen some, but not really. It's mostly the symptoms I just reported on.
We have a comment from Dr. Eva Stone. In schools, runny nose, fever, headache, and cough. Yeah, are you seeing that as well, Misty?
We are, and I will tell you, it is a little bit difficult, to discern some of that, because what else we're seeing tons of now is we see lots of respiratory illnesses, respiratory syncytial virus, RSV. So there's lots of other viruses out there that can early on mimic COVID, and so and some kids with really bad allergies. This is the season for some of this to flare up, but they're too close. You have to think about them when those kids progressively get worse. You've got to you have to rule out COVID.
So Ruth, I'm going to ask you a question related to masks, because masks continue to be a high discussion area. So what are your thoughts about wearing masks in schools?
I think certainly, the science is that masks provide that barrier. And when you look at especially children, how is this transmitted? We know kids are social by nature. Small children put things in their mouths, and then the other child comes right along and picks it up. So we know that we will see transmission among children. We see that in every other disease. But the use of masks, both by employees, whether if we are looking specifically at schools, ensuring that teachers wear masks, having parents talk with children about masks, and having that be, the social norm. There is no discussion about the evidence. And I think that's what's really interesting about, what is happening now with the questions about the mandates. The issue that, as I understand, and talking with friends that are attorneys, the issue now is the constitutionality of the government being able to interject that as a requirement. And so I think it would be interesting, to see on the news. I would love for somebody to, as they are talking with legislators who are specifically against the mandates, I would love for the follow-up question to be, but tell me what you think about whether or not masks work. And to be able to have it apparent that we're talking about two very different issues. That I had, an attorney that focuses a lot on civil liberties, and it really is extremely, if we look at conservative or liberal, extremely liberal, and saying, the ability for people to, to make decisions and to, protect then the Constitution and the constitutionality, was saying, look at this as if you're, people are saying, well, it's not a vaccine or a mask, but we want the government to be able to say, in order to bring your child to school every day, they must take a calming pill, because it's going to make it easier for the teachers to manage the class, and students are going to get along. So, and we know that a calming pill will be effective. Well, what if you don't want your child to take a calming pill? Is this similar? And I think the discussion from a Constitution perspective may be very similar. So from our perspective, what, the science is on our side. And that's what we continue to say, that regardless of whether or not this becomes a requirement of the government, we want to focus on what works, what is going to protect you. How do you then have those conversations with your children? How do you, introduce and ensure that masks become the social norm? How do you allow your child to wear a mask at school and address then other children who may not want to wear a mask? That, we always arm our kids with the age-old a comment of, my mother's making me. My father made me do this. So I know, I may not, disagree. You're giving your child a way out so that they then are able to comply with whatever the expectation is that you established as part of your family. But you can see automatically the challenges that we have. I go back to the science is there to support the use of respiratory protection, of a barrier as a mask. Our job is how are we going to keep and continue to have that integrated into any time. It's very biblical. Whenever two or more are gathered, wear a mask. Right?
Thank you, Ruth. We have quite a few more questions and we only have 8 minutes. So I'm going to ask you all to answer as succinctly as possible. So Misty, this one is for you. If a parent is on the fence with the vaccination, what gentle way would you suggest to have an informative conversation with them to enlighten them?
First, you should acknowledge that their feelings and concerns matter and that you're willing to listen. And then you sort of ease into how vaccines historically have worked and how we have eradicated other disease given with vaccines. And then just share with them that the minimal side effects and that the benefits outweigh the risk.
Okay, thank you. Misty, this one is for you as well. With the variant this time, seeing adults come off the ventilators. Are kids able to come off the ventilator without having to be trached?
Some are, most of them are, yes. But now I will tell you in the pediatric world, we don't tend to trach as quickly as they do in adults. But there are some kids that do require tracheostomies.
Okay. And there was another question.
There was a question about ECMO, Delano. I can go ahead and stab that one out too.
Okay,
so
go ahead.
So with COVID, there's an increase you worry about clotting. And does this affect children that have to be on ECMO? Because ECMO is, you have to be fully anticoagulated. To my knowledge, we haven't had any problem here nor in Louisville as well with anticoagulation with ECMO. And then there was one more, Ruth, Delano, I saw about long-term cardiac issues. Some children we have seen that potentially develop Kawasaki's disease, so another arm of MIS-C, and everyone probably is familiar with Kawasaki's disease. So it really depends on cardiac function, and coronary artery involvement. And we watch that. So that is watched very closely. They're followed from routinely with cardiology and echo and make sure that it returns to normal.
We're seeing the impact in kids and adults. It's pretty long-term, that this fatigue, this inability to get back to normal. And once you take away that ability to do more normal function, you start impacting long-term resilience. So I think that's where we're watching this really closely to see what happens. But if you start putting that into context of the discussion to say, not only do we want to keep your child off the respirator, but you only have one heart. And if we have then long-term damage to this heart, we don't know the impact of decreased cardiac function on every other body system and what this means to your child's future. So these are risks. When you think about risk benefit, am I willing to gamble with their long-term heart ability to pump? Am I willing to accept that risk? And so, again, putting these into very specific types of examples, and parents many times have a hard time. And this is what I've noticed, Misty, when you're talking with parents, if we tell them that, it's a high likelihood or a moderate likelihood, they may not understand. But if I say, this is a 1 out of 200, or the vaccine is a 1 out of 1,000,000, adverse event, whereas disease with COVID, if you get COVID, then it's a 1 in 20 chance that this may happen. So if we can give them numbers, and so getting that from the literature, I don't know if how parents feel, but what you think about sharing that type of information.
Yes, and I think it's really important that we share appropriate information with families. There's some great resources at American Academy of Pediatrics, as well as the CDC. So if parents, or providers, depending on what your opinion is of CDC and such, but the, American Academy of Pediatrics, there's all kinds of resources there that help support providers, nurses, whomever, to have discussions with parents.
Good. Excellent. Immunization Action Coalition, the website immunize.org is another great example. You can go there and get a lot of very parent-friendly patient-friendly tools and resources. So take a peruse around that website. That's another, I think, good resource as well. Excellent. Well, I know do we have time for one more question, Delana?
I was going to say we have time for one more question. Would anybody like to put something in the chat box or unmute themselves to ask the last question of the session? Okay.
Hi.
This has been excellent. Hi, Amy.
I just wanted to add something as you begin to look at the toolkits. Health literacy is a huge concern, and in the state of Kentucky, the standard is that products be produced at like a 5th grade reading level. And what we're seeing is a lot of the materials that are provided on our webpage are really written at a 10th grade readability level. So if you're using these resources if you copy and paste it into a Word document, it has a readability assessment tool where you can look at the readability level and make it the 4th grade reading level as you use it with your patients. And so I found that really, really helpful. So I just wanted to throw that out there.
Well,
I think that's a great point. When you're having those interactions, making sure that you're assessing what your patient or what your family is hearing. You may know what you are saying, but how do we assess then what you're hearing? And I know our pediatric colleagues are especially adept at, addressing their comments to children and to the parents. And so when we have questions, it'll be great to be able to post those back to Misty and other pediatric experts. And Misty, it's been fabulous to have you here. And
I have one more question. One more, Ruth, just one more. If you have COVID-19 and have not been vaccinated, how long before you can get vaccinated?
How about like 5 seconds? If you've had COVID, and you have, you are out of the isolation, your isolation period, or if you have been put in, we're using quarantine and isolation almost interchangeably, but if you had COVID, you're out of isolation, you feel like you are improving, you are not still feeling badly, but I would seek vaccination at your earliest opportunity. We just had a great publication from the state of Kentucky, from KDPH, talking about the impact of vaccination and how much better it is to be vaccinated than rely on, disease itself and those antibodies to protect you. You're much, much better off continuing to seek vaccination. So.
Thank you very much. Thank you, Ruth. I know you have to dash off. Thank you, Misty.
Thanks,
I want to remind everyone that we will have our next session next Friday at 1 o'clock from 1 to 1:30. It is the same link. However, if you want to receive CE, you do need to register on the KNA website. And also want to invite you to attend our summit on November the 4th, as well as we have a theater production that is going to be on November the 4th. It's called The Clinic. And it's a way for nurses to learn how to use mental health and resilience tools. So we want to invite you to attend those as well. Thank you again for attending today. We look forward to seeing you next Friday, same time, same Zoom link. Have a good day.